Hello, I'm washing my hands. My name is Megan Burgess. I'm a family nurse practitioner student with United States University. Do I have your consent to record this abdominal assessment and upload it to YouTube as unlisted for my instructors and my classmates to view?
Yes.
Thank you. And I'm going to real quickly just do a 360-degree room scan. Here's my patient. And here is one wall from floor to ceiling. This is my stand where my computer is going to be. This is my marker I'm going to use to mark his belly. And this is my ruler that I'll use to measure his liver span. There's my stethoscope is here, fan, sealing the floor. Nightstand, some flowers. Here's a mirror indicating that I don't have any outside assistance, nothing taped to my computer, no notes. Excuse me. Here's a mirror, floor to ceiling. The floor, and this is a clock and two family pictures. All right. So, can I please have your initials?
LB.
And when is your birthday?
January 23rd, 1987.
How old does that make you?
36 years old.
And what's your gender that you identify as?
Male.
What pronouns do you go by?
He and him.
Okay, and I go by she and her. So I'm going to do an abdominal assessment on my patient. Can I please have you lift your shirt up until right underneath your breastbone? Thank you. So the first thing that I'll do in the abdominal exam is just inspect his belly, looking for masses, looking for his umbilicus, his midline, looking for scars, which would indicate any abdominal surgeries, help you with your history and what you may or may not be finding. Looking for striae, looking to see if his abdomen is hollow, flat, or rounded or protuberant. Looking to see if you see any visible peristalsis, which would be abnormal. You don't want to see any visible pulsations. That could indicate that there's a aneurysm in his abdomen. Would mean that you need further investigation. Looking at his skin color, you want it to be pink and not yellow, which could indicate liver problems. At the same time, I'll look at his sclera, which they're white and not yellow, so he doesn't have any signs of jaundice. And that's everything that I am going to visually inspect for right off the bat. Then I'm going to auscultate his abdomen with my stethoscope. And I'm going to auscultate all four quadrants. So right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Listening for bowel sounds. His bowel sounds should be between, normal active bowel sounds are between 5 and 34 sounds per minute, and they sound like clicking and gurgling. If he had more than 34 bowel sounds a minute, that's hyperactive, and less than 5 sounds a minute would be hypoactive. And you would confirm that by listening for a full 5 minutes before you declare that he doesn't have any bowel sounds at all. But and then normal bowel sounds over gas, that's tympany. I'm sorry, that's when you percuss. So anyway, let me listen to his bowel sounds. With the diaphragm of the stethoscope, we listen in the right lower quadrant and the right upper quadrant. And the left upper quadrant. And the left lower quadrant. So his bowel sounds are present. They're about 20 a minute, normal clicking and gurgling. Then I'm going to switch to the bell of my stethoscope, I'm going to auscultate his aorta to make sure there's no bruits. That would indicate turbulent flow. Also going to auscultate his right and left renal arteries for the same thing, make sure there's no bruits, turbulent flow. Going to auscultate his right and left iliac arteries and his right and left femoral arteries. So the aorta is going to be epigastric area, center, midline, listening with the bell. Don't hear any bruits. I'm going to switch to the diaphragm. Then I'm going to switch to the bell, listen to the right renal artery, which is going to be above the umbilicus to the right. No bruits. Going to switch to the diaphragm, right renal artery. Then I'll listen to the left renal artery with the bell. No bruits. Listen to the left renal artery with the diaphragm. I'm going to listen to same findings on the left. I'm going to listen to now the right iliac artery, which is going to be below the umbilicus with the bell. And the diaphragm. There are no bruits. Listen to the left iliac artery with the bell and with the diaphragm. No bruits there. And then we'll listen to his right femoral artery with the bell with the diaphragm. Listen to the left femoral artery with the bell and with the diaphragm. Excuse me. So no bruits anywhere. Another thing that we can auscultate for is over the liver to feel, to listen for if there's any friction rubs, which would indicate masses. So you listen with the diaphragm for that. To go over the liver, you're in the right upper quadrant, right below the right rib cage, and then the spleen would be left upper quadrant below the left rib cage. Over the spleen, we're interested in seeing if there's friction rubs as well. So, which he didn't have any. So that's normal. Now we are going to percuss, and we're percussing by putting the palm of our hand on his belly and taking the middle finger on my dominant hand and tapping it on the distal flange of the middle finger of the hand that's on his belly. What we should hear is mostly tympany. Tympany means that you're over gas, air, and dullness means that you're over fluid, feces, a mass, a solid organ, something like that. So we'll start in his right lower quadrant, and you just tap it about 3 times at a time, and it's tympanic. And you just move going up into his right upper quadrant, move over going towards his left upper quadrant, down to the left lower quadrant. So it's, like I said, it's normal to hear both tympany and dullness, scattered areas of both tympany and dullness throughout, but tympany should be resounding. So then the next thing that we will percuss for is his liver span. So the liver is going to be in the right, the edge that we're going to be percussing for is going to be in the right midclavicular line, right underneath his rib cage. So we're going to start percussing from his right lower quadrant up, and it's going to sound tympanic until we hit the liver edge. So when we hit the liver edge, it'll sound dull. It should sound dull, and we'll mark that. And then we'll measure from the top, percussing down to measure the top of his liver edge. So starting down here in the right lower quadrant, percussing upward in the midclavicular line. So it switches from tympany to dullness right here. So I'll mark that spot. That's going to help me measure the height of the liver. So then from the upper edge, midclavicular line, you're going to, right underneath the nipple, you're going to put your finger in between the ribs. And so you percuss over the lungs and it should sound resonant. So you percuss downward until it changes from resonancy to dullness. And that's going to be the top edge of the liver. So to do that, just percuss downward. And his top edge is right about here. So I'm going to mark that. A normal distance is between 6 and 12 centimeters. So with my ruler, I'm going to measure, and his is 6 centimeters. So that's normal. Then the next thing that we can percuss is the spleen. So the spleen's going to be on his left side over here. And we'll start percussing at around the 6th intercostal space on his left midclavicular line, right at the border of cardiac dullness, because you'll percuss dullness over the heart. So right here, around right here, is where we'll start percussing. And then we percuss downward to his anterior axillary line, and from his anterior axillary line to his mid axillary line, that's called the Trout's space. And we should hear a tympany and no dullness. That would be a normal splenic exam. So I'm going to percuss 6 intercostal space, midclavicular, anterior chest at the level of the cardiac dullness. Percuss downward to his anterior axillary line in the Trout space. And it's tympanic. There's no dullness noted. Dullness would indicate an enlarged spleen. So it's normal to hear tympany and no dullness. The next thing we'll do is Castell's sign. So I'm going to percuss at the lower border of his left intercostal border. And I'm going to percuss, should be tympanic. I'm going to have him take a deep breath. And then when he takes a deep breath, I'm going to percuss again. That should push the spleen down. And if it was enlarged, it would be dull. Again, a normal finding would be for it to be tympanic for both. So, gonna percuss. It's tympanic. Can you take a deep breath? And it's still tympanic at the Castell's. A Castell sign is negative. It's still tympanic at the anterior axillary line. So the next thing that we could percuss for is his bladder. We would start right above the suprapubic bone. And ideally for the test, he would have an empty bladder. If his bladder was empty, you would percuss tympany. You'd feel tympany. Dullness would indicate a full bladder, bladder distension, a bladder mass. And that would not usually happen unless his bladder was full to about between 400 and 600 milliliters of fluid. So I'm not going to do it, but you would percuss from, like I said, the right above the suprapubic bone up, and you should just continue to hear tympany. The next thing that we will do is palpate. So we're going to palpate lightly in all 4 quadrants, and this is going to be assessing to see if he's wincing, if he's got any guarding, tenderness, rebound tenderness, looking for any rigidity, and This is also checking for superficial organs, masses, hernias, any bulges, anything like that. So I'll start with light palpation to his right lower quadrant. And then just palpate upward. Here's the right upper quadrant. Only palpating in about a centimeter. Then his left upper quadrant. And his left lower quadrant. I don't feel any masses. He's not wincing or in any pain. There's no rigidity guarding. So then we would do a deeper palpation. Deeper palpation in his right lower quadrant. Same thing, no guarding. I'm not feeling any deeper masses. And then in his right upper quadrant, palpating for the same thing. Now, while I'm up here in the right upper quadrant, I can palpate for his liver edge, his liver border. So I will have him take a deep breath in a moment. And when he takes a deep breath in the right upper quadrant, that's gonna move his liver downward towards my hand. And so I should feel a smooth, non-tender liver border when I do that. So I'm gonna put this hand underneath his right rib cage over here. This hand, can you take a deep breath? Palpating deeply and around 3 centimeters underneath his rib cage. I do feel his liver border and it is smooth. It's non-tender. He's not wincing. You can breathe normal. So that's that. And then I would palpate over here in his left upper quadrant and palpating in the left lower quadrant. Sometimes you can you can feel fecal masses down here and it might be tender sometimes. He's not having any tenderness. And the next thing that I could palpate for is his spleen. So to do that, I'm going to put one hand under his left rib cage. I'm going to have him take a deep breath and I'm going to take my other hand and feel deeply underneath his left rib cage to see if I feel a spleen. Normal would be not to feel it unless it was enlarged. So got my right hand under his left rib cage here. Can you take a deep breath? I'm palpating deeply under his left rib cage. Not feeling a spleen, so that's good. You can breathe normal. And that's going to be it for the palpation. Now, special tests. The first one we'll do is a test to check for cholecystitis. We call it Murphy's sign test. So in his right upper quadrant, if I was suspicious that he might have an inflamed gallbladder, I will tell him to take a deep breath and then let it out. And when he takes a second deep breath, as he's inspiring, I'll do deep palpation to his right upper quadrant. If his inspiration halted or he was hesitant or tender at any point, that would be a positive McBurney sign, would indicate that you need to do further testing for his gallbladder. It would be highly suspicious for cholecystitis. So take a deep breath, please, and let it out. And take another deep breath. And I'm doing deep palpation to the right upper quadrant. And there's no wincing. He's not stopping breathing. You can breathe normal. So that's a negative Murphy sign. The next special test that I will do is a test for appendicitis. So I'm going to go to McBurney's point, which is, so his appendix is going to be in the right lower quadrant of his abdomen. And I would palpate at the height of the iliac crest, his right iliac crest, towards the midline of towards his umbilicus, about 2 inches inward. And so you're in the right lower quadrant, deeply palpate. And if there were any tenderness to that area, it would signify that he's got potential appendicitis. So that's that test. And then another test would be if I was suspicious that he had ascites, I could do a fluid shifting test. So normally when a patient's supine or however they're standing or laying, fluid is going to shift downward with gravity. So if he had ascites and he was laying supine like this, his fluid would be shifting this way and potentially down. And so I would percuss, starting at an area of tympany in the central area of his abdomen, so tympanic, and I would just percuss outward like this in all directions, and I would percuss until I felt dullness, until I felt it shift from tympany to dullness. He's got no ascites, so he's tympanic. But so if there were dullness, I'm still suspicious of the ascites. I would have him roll onto one side, and if could you roll onto this side, please?
Yes.
Onto your right side. So he's on his right side. If he had ascites, the fluid would be shifting downward. So you do the same test. You'd start in the midline, in his central abdomen, and percuss, and it should be tympanic. If you went downward and you percussed and it turned dull going downward and it started to be tympanic all up around here, then that would mean that he's got ascites and the fluid is shifting downward. In a normal abdomen, you would find the same tympany and dullness wherever you initially found it before he rolled over. You can roll back. And the last special test that I'm going to do is to check for costovertebral tenderness. So can you sit up, please? And you're going to have to face that way. I need to see your back. So I would place the palm of one hand at his costovertebral angle, which is the border of this is his left costovertebral angle. Here's his spine. Here's his rib border. And you kind of thud on your hand with your fist like that. It should be non-tender. Do the same thing on the right side, the right costovertebral angle. And it's non-tender. These are assessing for his kidneys, making sure that there's no pyelonephritis or any kidney abnormalities that would cause his kidneys to be tender. You can turn back around. And that is going to conclude my assessment. Thank you. You've been a wonderful patient.
Thank you.